Welcome back to the Birth Blueprint. My name is Dr. Nicola Pemberton, Medical Director for Artemis OBGYN and the Birth Center in New Jersey. To my right, I have Michelle Gabriel-Caldwell, the doula coordinator for the Birth Center today of New Jersey. And for today, we have a special guest, Dr. Shelley Sousa from Flourishing Family Chiropractic, here to talk to us today about chiropractic medicine. Welcome, Dr. Shelley.
Thank you so much for having me. I'm so excited to be here. This is definitely one of the places that I've dreamed about coming to have this platform to talk about what we do in our office.
We're excited to have you here. This is a great time for a lot of people to learn more about chiropractic medicine, and we're really excited for this.
Yeah, and I think that that's really what it is for me, is providing any space where I can say a few words about what we actually do, because I do think it's very misunderstood. I think people understand that chiropractic care is good for neck pain and back pain and headaches, and it absolutely is. It's super effective in those departments, but it is a vitalistic practice. It's one that is meant to optimize what your body is already built to do. So it applies very well to, perinatal care. And when I say perinatal, I mean before you conceive, during your pregnancy, and postpartum. It's all important to have your body ready to conceive and then to have a healthy pregnancy and just help with the outcomes of labor and delivery.
Yes. So tell us a little bit more about what is chiropractic medicine.
So we absolutely are bone doctors. And that's what we're known for, because the adjustment is to help the integrity of the spine. So by nature, the spine is stable, but has to have flexibility so we can move. So with that inherent flexibility, it does misalign. And when that happens, the major issue is that it will affect the nerve that's exiting right next to that bone. And then the nerve compression is really where the major dysfunction comes from. It's the bone that might be the inflammation, the muscle spasm, and that musculoskeletal response that everyone knows we help with. But it also has an impact on the way that the nerve can basically take the information from the brain down the spinal cord and out to all of the organs in the body. So when we're putting bones back in place, we're also decompressing nerves. So I think a buzzword here is pinched nerve. That, I think most of us understand that is excruciating. It causes a lot of dysfunction, again, in that musculoskeletal system. But the reason that the person's hand also might go numb, or their arm is numb, or they can't grip, is because it's also impacting the nerve. So that's really the main component, is the health of the nervous system, so that the body can do what it's built to do. So as it pertains to pregnancy, there's a big mechanical side that is beneficial, but also you want to make sure when you're conceiving a baby that your nervous system has a good tone, right? It's more in its rest and digest state rather than the sympathetic state that we're all running around in. So that's what the adjustments help with. And also just one-to-one, right? Any nerves that are going to your reproductive organs, you also want them to be firing properly. So it is a holistic form of care. When it comes to the mechanical side, the pelvis is always the main thing that we go toward. And it makes sense, if I may, with the pelvis. Mechanically, again, with the bones, we are always looking to make sure that this pelvic opening is a nice open round circle. Okay, so that's what the adjustment is for. But the uterus is also anchored to this structure. So there's soft tissue that comes into play. Imagine that the uterus is sort of like a hot air balloon, and it's tied down to the ground or the pelvis, right, by the ligaments in the front and the ligaments in the back. So if there's any torsion in the bony pelvis, it's going to pull unevenly on the uterus. And that's really what makes it difficult for the baby to position themselves properly and also to engage into the pelvis. So we do a lot of work like pelvis and low back focus work. The other part is that, again, I'm sure you see it in your practice all the time, right? What is like the number one complaint other than, having a baby in their body?
Sciatica.
Exactly. So that is, again, the nerve being compressed by something in the low back or the pelvis. It's nerve compression. So it's really great, aside from making sure that the baby can engage, turn head down, properly aligned to come out. What about a pregnancy where you don't feel miserable? You know, it's really important. Like, your experience can be defined by the suffering.
Right.
So it's nice to feel more comfortable, to not have pain shooting down your leg.
Right.
So there is definitely, for me, a pleasure in helping moms feel good. Yes, I care about birth outcome. Yes, I want their nervous system firing, but I care about the mom, right? And I want them to be able to enjoy the miracle that they're a part of. So if I can make them more comfortable, that's an added bonus.
I have a question. Please explain to us how chiropractic care can help with fertility.
So this goes back to the nervous system for sure. So we don't treat anything. I just want to be clear. We're not treating infertility. But again, the way that your body regulates its cycle is through many pathways that the brain is in control of, whether it's sending messages down the spinal cord and out the nerves to the reproductive organs, but also you have so many different glands that need to be firing and producing hormones in the proper way as well. So if your nervous system is misfiring, it can cause dysfunction in pretty much any system. So it's not like there's a button that we press that cures dysfunction. We use our clinical tools, just like for anybody else, we use our clinical tools to determine where the nerves are compressed, and then we apply the adjustments in those areas, and it just makes the body work better. In my experience, it's really regulation of the cycle that tends to be, because we'll have ladies that have missed periods, or they're not ovulating, and so again, I'm not doing anything specific for that. It's just regulation of the nervous system that then gets that to just work the way it's supposed to. And that tends to be about a 90-day window before things are kind of,
It does take a while for that
absolutely
adjustment. So this is why you would talk about multiple
absolutely
appointments and coming, because everybody likes to think it's just going to take one adjustment and then I'm fixed.
I love that you're asking me this question because I just, that dysfunction didn't happen overnight. It did not come in 1 week or 1 month. It could have been there for decades. And so it does take time and repetition to get a result for any of the things that people walk into our office for, including making sure that your baby is in a proper position. Ideally, I would like a woman in our office prior to conceiving, but at the very latest, around 20 weeks, you have a relatively full-grown baby in there, and the space starts to get more restricted. So if you're looking for optimal labor and delivery, you want to start care at a minimum of 20 weeks.
But I wanted to go back to that fertility because what I like about it is the fact that you said, one, it doesn't happen overnight when it comes to seeing relief measures from the chiropractic adjustments. But when women do come to me saying they're trying to achieve pregnancy and they're having the difficulty with their menstrual cycles, I love the fact that I can tell them, hey, you know what? It's not just about here's a magic pill, let's see what we can do to get you pregnant. It is, what are we doing when it comes to nutrition, health, exercise? Are you smoking? When's the last time you've seen your primary doctor? Because there's some other medical conditions that can contribute to the success or the delay in achieving pregnancy healthy. But it's nice to know that this is could be just a part of that.
Absolutely.
You know, when we say holistic, I mean, it really should be a part of it. It takes, give or take, a minimum of 90 days just to see a change in, let's say, weight, how you're fitting your clothes. If you're doing an exercise regimen, when it comes to weight loss, why is it going to be any different when it comes to?
Yes.
Yeah, so I like that. That 90-day window should be, I tell women, it takes about 90 days to start seeing some results. It should be the same if you were going to incorporate chiropractic medicine for the fertility aspect. It should be something that can be,
yes. And we do naturally counsel our practice members on exercise and nutrition. And we do have the ability to send for blood work and take kind of a wider view of what's going on internally, because it all matters. It all matters. But I just have to say, there are people that just don't want to do anything else, and all they do is get adjusted, and it still makes a huge impact on their overall health and how they're doing.
So that goes back to, you mentioned the sympathetic and the parasympathetic.
Yes.
I want a little more detail on that.
Sure. So I love to teach again, so thank you. I like to equate these to your fight. Your sympathetic is your fight or flight. So this is your adrenaline system that gets you going. So in an emergency, like you're going to drop a bunch of adrenaline and you're going to go, and that is very helpful. But then there's a parasympathetic system, which is your rest and digest system. This is where all your automatic functions in your body come from. So this is your heart rate, how you sleep, how you digest. It's all controlled in that.
Even intimacy.
Yes, and it's all controlled in labor and delivery.
Yeah.
I'm sure.
Yeah.
I know, I've been a student of yours. I know the conversation around how do we get labor going is relax, right? Get into that parasympathetic system. Unfortunately, our world is we're really supposed to be 80% in parasympathetic and 20% in sympathetic. And we're the absolute 100%. We put our feet on the floor in the morning and we just run and push adrenaline. And then at the end of the day, maybe that's when you turn it off. My favorite result of the adjustment is watching someone sitting in the chair in front of me, and you apply that first adjustment and you just watch their shoulders go from up here to like here. And you just watch them take this big, deep breath. So just stimulating that system, and that's science. There is science on what happens in your nervous system. You immediately block cortisol and adrenaline and start pumping serotonin and dopamine, which are all of your happy, feel-good hormones. Yeah. So when that happens, you are going to aid in fertility. You're going to aid in digestion. You're going to aid in labor and delivery. Yeah. So it is that power that really, I think, does the magic. Yes, the mechanics are important, but it's the nervous system where the magic comes from. And your body knows better than I do. So you kind of trigger this like innate system that is built in. It just kind of gives it a reboot to do a better job.
We are both patients of yours.
Yes.
And I can say I truly enjoy sitting in that dopamine, serotonin space.
Exactly.
Especially when we're all go kind of people in the fields in our respective fields. It's almost like therapy for the body. When you come in and you speak to your therapist and get it all out, you come in and just get adjusted and be like, okay.
Exactly.
Exactly. And it's a big deal.
Relief.
It's a big deal.
It is. And so this can also help in that. That's kind of an indirect way it helps too with breech positioning. We see a lot of referrals and people also that are just kind of Googling along the way and they want to find out how can they help with position of baby. Because, if you have a baby that is not head down, then you have a C-section. So if you want to put an effort in that direction, one of the main things that you'll find is chiropractic care. There's actually the Webster technique, which myself and my partner, Dr. Isla Clemente, I forgot to mention her. We are equally trained and both certified in Webster technique. And it is not us doing anything to the baby. So again, it goes back to aligning the sacrum in particular, because that's the back attachment of the uterus, and then coming to the front and making sure the round ligaments are loose and open. And by setting everything straight, it opens up the uterus, decreasing any intrauterine constraint that's going on, and then the baby turns themselves. So I just like to make that clear. We don't do anything to the baby.
And I would just go even a step further. A lot of the times people do come to you once they've found the baby in breech position, but it wouldn't be ideal. Same thing like you said, instead of waiting until you're pregnant to see a chiropractor, you should be doing it prior to achieving pregnancy. The same thing is that if, let's say, you did achieve pregnancy, it should be one of the earliest appointments. Besides seeing your obstetrician, you should be seeing.
Don't wait too late.
Yeah, you should be seeing them just to get the pelvis ready.
That would be in an ideal world, right? That would be the standard in an ideal world, is just like brushing your teeth.
Or taking prenatal vitamins before you get pregnant.
Yes.
Okay, versus
it's
waiting.
preventative.
Care though. Right?
Absolutely.
So it's meant to not take the place of, but to work together. And
absolutely.
In the class, I know we talked about this before, but obviously I'm not going to give all the details about everything, but I do know about the round ligaments. And I just do the demonstration of, if you got 2 horse reins and you're pulling one this way.
Exactly.
Where's that horse going? Over there.
Mm-hmm.
So I was like, where's that baby going? Over there. Mm-hmm. And they just go, oh, yeah. And I go, yeah, so get thee to a chiropractor.
Exactly.
Amen.
Exactly. And the front of the pelvis too, we don't just stop with the round ligaments. We do usually assess the pubic bone in the front here for the same reason,
Mm.
but also because this is another thing that is extremely common symptomatology wise, is to have pubic bone pain.
Yeah.
And I know I see it, and I'm sure that you could like attest to this. I see it less often with first pregnancies, but most second-time moms, third-time moms, fourth-time moms, this area has been so
Stressed.
traumatized and
Yeah.
stressed.
Mhm.
And there's like this shifting where it kind of separates back and forth and creates so much inflammation that we also do adjustments on this area. And although it's a tender adjustment as it's happening, it is so effective for that like groin pain, pubic symphysis dysfunction as well. And I don't know about you, but I want the entire alignment from front to back and soft tissue open for labor and delivery.
Absolutely.
So I know also too, and I appreciate the referrals because because of this, again, we can never tell why. Sometimes the breech babies in first pregnancies don't turn. But when we get a mom who's early on and has had that previous history of a C-section from breech, we have such a high success rate in helping women have successful VBAC experiences.
Absolutely.
So
let's talk about the feedback. I mean,
Yeah,
unless
I'm
you
sorry,
want to get
the last data piece that I remember about the effectiveness of breech turning with the Webster technique was 87%.
Yes.
Is that still?
that is still the data.
That's amazing.
It is
a lot of
amazing.
people
Right?
don't realize-
Compared to what? Like
Yeah.
external version?
It's like 50-ish
Just
percent.
85% of is a success rate for a woman to achieve a vaginal birth after C-section, regardless of what the indication for that cesarean section is. Their rate, as long as they have the right uterine scar, that's pretty high. But I think what people don't understand is there's got to be a little bit of extra behind it. If you're going to achieve that success, it's like you should be piling it on. If this says my chances of having a vaginal birth after C-section is in the high 80s, and you're telling me that Webster technique helps achieve that, even when you're talking about, let's say, breech was being then there should be automatically a link to, if I had to have a C-section for whatever reason and I want to attempt a vaginal birth, why not incorporate this, regardless of what my indication for the C-section was? Of course, pending all the right things align, you should be looking to this as, I need to increase my chances of it being successful.
I agree completely.
You know,
And I really should, and don't get mad at me, but I really should actually take a look at our data set and see what happens in our office. But I really can't think off the top of my head of people who have come in, I would say prior to 36 weeks, looking for care for TOLAC, for the trial of labor, and then not actually getting that. It's our data is, our outcomes are really good. And again, is it the bony pelvis that's the success rate? Is it because moms have a place to come to feel better? Is it the nervous system? Who knows? It all works.
I think it's
it could be a combination. It's multifaceted in that regard.
For
Yeah,
sure.
absolutely.
It's definitely multifaceted.
And I know too, one of the main things that I wanted to talk about, if it's okay, is also postpartum care. Because sometimes the care postpartum can be more sporadic, right? So I get an opportunity to have moms come back, I think, sooner sometimes, and I'm able to help with rehabilitation of their pelvis. I tell them, having any kind of birth, no matter what, it's sort of like a car accident for your pelvis. You're all stretched out, right? All the ligaments have worked to stretch you out, and now everything has to come back. So there should be an active role in having that. So when ladies come back, we're very much helping their pelvis to heal, but we're also helping their nervous system to heal. And the fact that we see a lot of the stress now shift up to upper back and neck stress because they're hunched over a newborn baby, right? So not one is not more important than the other. And I find joy and happiness in helping in both departments, but it's the best when I can look at a mom and just see she's the center of that baby's world. So the more I can help her feel better, the better she can be for her baby. And again, enjoy it. It's not easy, right?
It brought up a question for me, because sometimes the patients will ask, well, Dr. Pemberton, I was told, and I know Michelle can add to this as well, that I should be doing pelvic vaginal exercises in pregnancy. I should be working on those Kegels before it becomes a problem after delivery. So what's your take on that? when it comes to the pelvic floor?
So I think that it's important to have a strong pelvic floor for delivery.
Mhm.
You know, that's the actual muscles that are down here. And for certain, the tension in that strength in that, I should say, is going to be a determinant in how your baby tucks their head and
That's in
needs
the
that
right position.
resistance to get in the right position. And this is all you, girl. Okay, this is not me. This is my birth classes still in my brain on how if the pelvic floor is tight, you're going to get the back of the head to exit first, which is much narrower than the wider part, right? Than the whole front to back. So it is very helpful to have a strong pelvic floor. I would venture to say, though, that postpartum, you want to allow for healing for those muscles first before you are trying to strengthen them. And honestly, this is where I refer for pelvic floor physical therapy. I am an expert in chiropractic. I am so happy to be an expert in that department. And when I see the need, I am the happiest person to refer to another expert, right? Because unfortunately, you can't tell yourself if your pelvic floor muscles need to be stretched or strengthened.
Right.
Sometimes if they're too tight and you're trying to strengthen them, you're actually creating more of a problem.
Right.
Yeah.
So I always really recommend, I think postpartum care should be standard chiropractic care and pelvic floor for every woman that delivers.
So now I'm going to say to Michelle, to do or not to do when it comes to pelvic floor strengthening. A lot of the times women feel like they're afraid of, you know, because of what they heard birth can do, and they don't want those concerns for urinary or fecal incontinence or those changes where they're like, oh my God, it's just so weak down there. And some of them would actually be proactive in trying to strengthen those muscles, but sometimes I feel like it could be counterproductive when it comes to labor. What is your take on that?
Yeah. So, I mean, clearly I'm not a pelvic floor therapist, but as a childbirth educator, some of the things that I do mention is working on the pelvic floor, really kind of getting an assessment just of themselves. Like, are you incontinent when you sneeze? Like, what's happening when you cough? Like, what's your pelvic floor doing? Just have that alignment in your own self of what's happening. But it can't be just because those muscles are not just horizontal, they're not just vertical, they're spiral as well. So there's a lot of movement that needs to be taking place, and Kegels alone are only isolating one part. So it has to be a combination of doing those circles on the ball, doing those squats, like you have to be doing like all of those things, and really to get that, you know, the full benefit of the muscle. And I think people just highlight one thing and not the other, aren't walking, aren't doing, aren't doing, you know, other exercises to maintain just their muscle strength.
Yeah.
So that's why I feel like what you're saying to me, and this is for my education too, and when patients ask, because I can learn from you guys just as much as people try to think they can learn from me, but you know, when you're doing exercises in the ball, we're talking about vaginal muscle relaxation, because we don't want I would say, please don't take your vagina to the gym, you know, because you start looking like you're pumping iron and everything's so tight, and it's kind of hard to allow baby to make their way and descend into the pelvis as we want them to. But at the same token, you're talking about strengthening. So is that you're saying is a combination based on the exercises that we're talking about?
Yeah, I mean, there's some people that do absolutely nothing,
That's true.
right? And you're already talking about just the weight of the baby, the placenta, you know, there's a lot of additional weight that's on that pelvic floor that never existed before. So let's do something with that. And if you've not done anything, then you're probably going to be more prone to having this malpresentation or this long pushing phase and things like that, right? So just, I'm not ever telling anybody to go ahead and let's start attaching weights to our pelvic floor and, you know, and start doing some wild things like that. But it really is just, you know, just 50 contractions a day, you know, just kind of move that muscle. Just remind yourself that it's there.
You know? And neurological engagement. Like if you're not doing that at all, your brain starts to forget that it's connected to that. So that part of exercise in general is like re-stimulating pathways for the connection to those things as well.
So a combination therapy. So
I think it has to be a combination of all the things, right? And you know, if you were able to go see a pelvic therapist before, during, and after, amen, absolutely.
Yeah.
Do it, because
Definitely.
you know, I went to one 58 at 58 for the first time. And you know, I was, because what's it called?
Diastasis recti.
Yeah, right. So I thought for sure, like, this was the reason that I had the poof. And she was like, no, your pelvic floor is healthy. And I went, darn, okay, I can't make that as an excuse.
Yeah.
But it was really, you know, just a good piece of information for me to know the health of my pelvic floor, which I had not done before. So my other question is, based on putting bones back and, you know, all the stretching that birth happens, what do you think about things like belly binding?
So I have mixed feelings. Because I'm not a big fan of like immobilizing anything because of the negative feedback. So I understand that the belly binding could help with like organ placement and support, but you're then also, again, neurology, you're sending a negative feedback to your core muscles to be active. So when you wrap something, your brain goes, oh, okay, I don't have to be as strong here. So if you're talking about recovery, you really want to start gently activating your core by just moving around your house on a daily basis. So when you bind, you're going to again, your brain's just going to be like, okay, well, I'll just be lax here in these abdominal muscles because, you know, you got it.
I love that. I'm going to segue into that a little bit, because even from my standpoint and in a surgical standpoint, both obstetrics for those who've had to have a C-section or who have gynecologic surgery, we tend to use the abdominal binder. But I advise my patients, do not use this binder unless you're moving.
Exactly.
Because of especially when you've had a C-section, you're using core just for the basic things, getting up and sitting down and standing up from a chair, from the toilet, from getting it out of the car, moving in your bed. You use your core for
it's splinting.
everything.
Yeah.
So that splinting is just that sensation of every time I move, it feels like everything's gonna rip and tear and burn and my guts are gonna spill. So that when I tell them use the binder, it's usually with movement. I said, and when you're resting, take it off.
And
now that you're saying that kind of like reinforces.
Do you recommend it though postpartum for like vaginal birth?
No, not necessarily.
So there's a difference, right?
It's only
if you've
for those
been
who've
cut
had
open,
surgery. I said, and when you're using the binder, I'm telling them to use it with movement, not sitting in the chair, in the bed, or in the couch with the binder on, because then I'm encouraging the same thing even in GYN or in C-sections, just to sit there and do nothing. I said, you only use it with movement.
Yeah, and every birth is a different scenario. Right. So nothing is going to apply to every person. You have to take it case by case. And I could see where if you've been cut open and your muscles are damaged or healing, and your tissues are all healing, so maybe you would want to bind in that case, especially with movement. But I was curious if you recommend it for like postpartum vaginal births.
I haven't.
It's a huge thing, and I'm going to be honest that, you know, it's something I thought I should have had after having my children, because I wanted to feel secure. Like there's that jostling feeling of your organs. You have all that space that's there, and you're still kind of you look like you're 4 months pregnant after having the baby. Like you're still, there's all that there, and it just felt like
nice to have a hug on the belly.
It was just like a wonderful feeling and sensation. So I'm torn by just what should we be doing if not that? Do you recommend chiropractic care that early?
I see women as early as 3 to 7 days after they've delivered. Yes. And even so, this is an art, right? Is the amount of experience we have postpartum, we're able to work with that person to figure out what their body can tolerate. Mm-hmm. So I would say C-section is always more difficult, but we have multiple different tables in the office that don't put any pressure on the lower abdomen at all.
I usually tell them to come and see you after 2 weeks, because that's when I usually clear them for the basics. Can you drive?
And I'd say
do
that's
certain
average,
things. Yeah.
right? I'd say like 2 to 3 weeks is when most moms come back. But if they've had a tough delivery or they're feeling like they need it, we make it work with whoever comes through the door. And if we can't provide a pelvis adjustment because that area's had some more trauma and they can't tolerate the positions, don't forget you're a whole person. So anything I can do to relieve neck pressure on the nerves up in the top of the spine or the middle of the back is going to have a ripple effect through the body and that effect on the nervous system. So that's the other part of, how early somebody can come back. But I understand what you're saying, but I think this is a gray area, right?
Well, I mean, you think about it traditionally, there's so many closing the bone ceremonies.
Mhm.
There's just, a lot of different cultures.
Yeah.
Think about, how to move everything back together.
They
again.
ask about the faja.
Yeah.
They do.
Yeah,
Right?
but how, and so this is, you're just talking about like initially for the first week or two.
Essentially, I think there are some clients of mine that will want belly binding 3 or 4 weeks after having their baby. So
I don't think it's harmful.
because
I just think it needs to be limited so that it's not ongoing for months or 8 weeks or 7 weeks.
No one's doing it that long.
Yeah.
Like you're taught to put it on. You have to take it off when you shower. So it's different ways to manage it, but it's just that security, like you said, like that kind of hug.
Yeah.
That's keeping you able to move. But my thing is like, are you really supposed to be moving? Because we're talking about, right?
You really should be laying down.
The 5-5-5, the 10-10-10. You try to tell somebody 15-15, they lose their minds. But I go with the bare minimum. I just give me the 5 in the bed, 5 on the bed, 5 around the bed,
Mhm.
right? So if with that movement or lack of movement, do you think, I don't know, is it bad or good?
I don't think it's bad. I don't think it's anything harmful.
Okay.
I just would encourage that at some point in the first month, you're reawakening the use of keeping your brain and your core connected.
So it just needs to be connected.
Yes, absolutely.
Like that.
Yeah.
Connection.
Yep.
Wonderful. One subject that we talk about is always with moms to be, pregnant women, women who want to be moms. Now, when they're after moms, we talk about the rehab when it comes to postpartum care. But then the people that they were pregnant with, where do they get benefit? The newborns.
Oh, okay. So this is, again, I love this because along with perinatal care comes newborn care.
Yeah.
And mom and baby are working together the entire pregnancy. And labor and delivery can be difficult strain on both mom and baby. So we do recommend checks for babies, newborn babies. And it's because they're also in this like really contracted space for a long time. And they depending on how they, come out, it can be a strain. And we mostly see it in the cervical spine, which is the neck.
I think you and I had that conversation.
Absolutely.
I had no idea. As I said, in the course of opening the birth center and learning so much from Michelle as a doula, and then learning so much from you as a chiropractor, that I could have brought my children.
Yes.
And I felt so like robbed, but because my youngest son, when he came out, even though it was a very easy delivery, he did have the torticollis, as we call it, which is the neck is kind of contracted to one side. And it was like, every time you turned his leg, it went right back. And I was like, was that the position he was in? And it really, and when you said to me also how it helped when it came to speech, because he did have a little bit of a speech impediment when he was a toddler and he had to get speech therapy. Those are things that really like eye-opened for me. I was like, my God, everybody should know about this.
Absolutely.
Because I wish I did.
And that is one of the traditional presentations where the baby is stuck to one side and they're, you turn them, they're right, you turn them left, they go right again. And
that makes breastfeeding kind of
that
weird
is sort
too.
of where some of the referrals come in as well, because if a baby's stuck to one side, they're going to have a difficulty latching on both sides for breastfeeding. And also it affects the jaw. So the ability to open wide enough to actually, like whether it's bottle or breastfeeding, can be an issue that chiropractic care helps with. And then if their latch is not good, it leads to gas intake. So it also can show up sometimes as digestive issues. And then remember, like, the whole nervous system component, right? A lot of their misalignments are in the upper part of the neck. And if there's constant irritation on the brainstem or the nerves up there, it could just make the baby irritable, right? It can be in the form of a
Colic.
Colic. Yes, colic, right? An irritable baby. You'll see them sometimes like rolling their old head back, trying to relieve neurological tension. So that's some of the presentations that we get. We also have a lot of referral and help for babies that have tongue tie issues. So post tongue tie revision, which is where they're going to go in and cut the tissue so the baby's tongue can move freely, their cheeks are wide open. There's also neurological patterns stuck from prior to the revision that needs to be rewired, and that's where chiropractic care comes in with that as well. So we really do play a role in feeding babies and getting babies to thrive, and also avoiding like helmets. They're everywhere now, which I'm happy because they're understanding that the shape of the cranium is extremely important for development in the brain. But if the baby's only stuck to the right, you bet you're gonna get a flat spot on the back of the head. So you can put a helmet on to help the shape of the cranium, but you have to fix the problem.
Yes. It's like not just putting a Band-Aid on it.
And I just have to add, I know we're gonna kind of shut down the conversation soon, but chiropractic care is tailored for each individual that comes into the office. So when a baby comes in, I am not pushing. There is no cracking sound, which I don't even like that terminology at all, because if I cracked things, I'd be in trouble, right? It is gentle fingertip pressure, the same amount that it would take to dent the skin of a tomato. And it's just a sustained hold. And it's usually with my pinky. And then we do some craniosacral releases to help the tone again of the encasement around the brain and the nerves. And I mean, babies, it really is just so super helpful for them to, again, be happy. And there's that cycle again, right? Mom's happy, baby's good. Baby's happy, mom's good. So really, that's another reason why I always encourage moms to have their babies checked.
Does it help with babies and sleep as well?
Absolutely. I will never guarantee that, though.
Okay.
So when moms come in and they're like, can you help my baby? Can you make them go to sleep? I'm like, well, I can adjust them, but I will not promise that, because there's nature as well. And their nature is actually to be awake every few hours to eat. Exactly. So sleeping through the night,
not yet.
No, exactly.
But it might help with that less of that colicky situation.
That's exactly right.
The gas, the indigestion.
All of that. It just puts their nervous system at ease, just like it does in adults. Yeah. So then moms, the most reported back information is like, I took them home and they just like slept for hours and they were so relaxed.
Well,
and
they also just got really adjusted.
Yeah.
And they've got serotonin and everything flowing through too. So they're like, hey.
The best part for me is the longevity of some of my practice members, where I get to take care of a woman before she's pregnant, during pregnancy, postpartum. Then I'm adjusting her kids and they're growing and they're the first ones in the chair, like, so that is really the main staple of the practice is like, let me take care of everybody.
That's why it's called a family.
Family practice. Yeah. Yes. Family practice. Exactly.
And
so
I feel just equally upset like you that I didn't go with my children, newborn care.
Yeah.
But the same thing I said
it's
about
never
doulas.
too late. This is what I want to say.
But wait,
too.
but my kids have been with you since
they were young.
Oh my God. They've been
10
young.
years ago.
So it's been amazing to assist with just growth spurts and, they just getting into their own little teenage bodies and everything. Like, all of it. They they look at me and go, oh my God, Mom, oh, I need an adjustment.
Yeah.
Like, you sound like you've got a job.
And they wouldn't be able to put their finger on the reason. It just feels good, right?
I've worked for 20 years.
Yeah, like you sound like you're out here just working out here. I was like, what? These are my kids. You made my kids bougie. Thank you.
I've made your kids healthy and in touch with their body and what their body needs.
Oh, see? Bougie healthy.
Yes. And I just wanted to add on, because you said something before that like triggered like pelvic floor PT.
Yeah.
58, right? It's never too late.
It's never
I
too
don't
late.
care if you had and this is for men too. I know that this is a birth podcast, but it's never too late to get checked.
Yeah.
It's never too late to get adjusted. And if you had trauma in whether it's labor and delivery, postpartum, raising your kids, it is legitimately never too late to come and get checked.
Not that I'm going to be switching to the other side here because I'm still, women's health. But when you mention men getting pelvic floor therapy, does that help them with urinary health, prostate health? Is that something
and it's the same. Yes,
Yeah.
pelvic
And
floor
colon
is
health.
for health is for males as well.
Yeah.
I think it just gets narrowed down to the ladies because we have more trauma and
Yes.
more things that go on.
Yes.
But it's the same thing for fertility.
Yeah.
I don't just want to see the woman
Because
Yeah.
it's not
because it
just
takes
her-
two to
It
make
takes
a
two to
baby.
make a baby.
So
That's
the
right.
health of their nervous system
That's right.
is extremely important in how all of their organs and hormones are functioning.
Mhm.
So really it should be both, both partners coming in.
Amazing. I've learned a lot today. A lot more. I mean, you've been always very educational, teaching, giving with your information. Absolutely love it, enjoy it. My staff benefits from it. My patients definitely benefit from it.
Yes.
I benefit from it. But I actually learned a lot more even today. So this was an amazing session.
Yes, thank you so much.
Thank you very much for being here.
Thank you. So I want to let everybody know if you want to come to our office and be evaluated, we're in Clark. It's 68 Washington Street in Clark, New Jersey. Our website is myflourishingfamily.com. And actually, it's all brand new. And the office number is 908-653-0000, which is a cool phone number. Not hard
Very easy to remember.
Yes, it's very easy
Yes.
to remember. And, it would be an honor to take care of whomever comes in. I just enjoy it so much.
I do have to tell you, my husband's dad,
Yes.
88,
Yes.
first time ever going to a chiropractor
That's what I'm saying.
with you.
Yes. It's not too
Loved
late.
it. Can't stop talking about you.
Again, because it's tailored care. I'm
Completely.
not going to take
Yeah.
care of a newborn the way I take care of a 40-year-old, the way I take care of an 80-year-old. It has to all be
Yeah.
for that individual.
So, like you said, it's never too late.
Never too late.
Yes.
Wonderful. It's a
Thank
pleasure.
you.
an
Thank you so
honor.
much.
Thank you.
Thank you.
Thank you for watching. Please like and subscribe, and feel free to leave any comments or questions you may have. And we look forward to seeing you at our next podcast.